Welcome to the CURES Show, where we explore the cutting edge of wellness. I'm Kara Sundlin. April is Autism Awareness Month, and right now, autism is the fastest growing developmental disability in the world, with about 2% of the people in the U.S. being on the spectrum. So here to help us learn more about how autism affects a person and why it's seemingly much more common now is Dr. Laura Saunders, a child psychologist at the Institute of Living in Hartford. It's also where they've just established a new Mary W. Parker Autism Center for comprehensive and multidisciplinary care. So thank you so much. Welcome, Dr. Saunders.
Thank you for having me, Kara.
I think it's a term that, of course, everyone knows, and a lot of us are maybe even getting involved in charities or learning a little bit. Our kids are learning a little bit at school, but I still think it's something that people are very confused about as far as how this affects people and what it is. So can you first help us understand exactly what is autism and how that manifests in a person?
Yes, so autism or autism spectrum disorder, so now it's kind of the acronym is often ASD, Autism Spectrum Disorder, is a neurodevelopmental disorder. It impacts three core areas in, it's diagnosed in childhood, but three core areas of a child's life: socialization, communication, and behavior. And when we say spectrum disorder, it's because each area might have more or less deficits. So it is considered a spectrum, whereas we used to call those individuals more at the higher end of the spectrum who had therefore less deficits, Asperger's, but we don't really use that term anymore, but some people know the term Asperger's syndrome.
Okay, so Asperger's is sort of an outdated term, and now we would just say that that person has autism spectrum disorder or is on the spectrum?
Yeah, you could say on the spectrum or autism spectrum disorder. Yeah, and we look at it again along a continuum. I don't want to get too clinical but yes.
Okay, so you mentioned autism has to be present from childhood. I know that some people actually aren't diagnosed until adults, so we'll talk about that later, but present from childhood. And we learned that birth to 3 services can be so important. So what do parents need to know? What should they be looking for just to make sure they get the right care as early as possible, and why that's so important?
So obviously, when in younger children, when deficits are more pronounced, you will see them at a very young age. I mean, you can when deficits are more pronounced in the areas of socialization, communication, and behavior, you can absolutely see those deficits before the child is 3 years old. I mean, in young children, it would be what we call stereotyped behavior. So some of like the hand flapping and other kinds of behaviors. In terms of communication, they may be very delayed in starting communication skills. And in terms of socialization, they often don't have what we call reciprocal communication. So they're just sort of caught up in themselves. They don't give you eye contact. They might look away a lot and not ever make eye contact. So, and they can't participate in a lot of the reciprocity of communication. So I keep going back to the 3 core areas: communication, socialization, and behavior.
Yeah, and those are, I guess, some of the basic ones. And this is something that on your well visits, your doctor generally will have some sort of a form. I know parents always worry about milestones, like, oh my gosh, are they meeting the milestone? What type of milestones do we need to think about?
So, as I said, there's we look for behaviors, movements, phrases. We want to see that your child's, it's that they will develop physically, like they might sit up, they might start to crawl, they might start to walk, but they're not developing in terms of their communication and socialization. So you might see a lack of response to their name. Really, by the time a child's 9 to 12 months of age, when they've heard their name repeatedly, they can respond to their name. If a child's looking away, a baby's looking away, and you say their name, they'll turn to their name. So it might be a lack of responsiveness to their name, really difficulty understanding and expressing feelings. That's for more toddlers. Avoiding eye contact, as I said, and more atypical verbal communication, repeating a lot of phrases over and over again, repeating single words or single phrases, So a lot of oddness in their communication.
And you say there are three main causes of autism. We hear certainly a lot more about it now than we did when we were growing up. Can you talk about the causes and why we're seeing more of it, or are we seeing more of it?
So the main causes are pretty vague, which is that there's environmental causes, biological and genetic factors, but it's not any one thing. What I want to emphasize, and I cannot emphasize this more strongly, vaccines do not cause autism spectrum disorder. So that was a myth that got perpetuated a dozen or more years ago. Vaccines do not cause autism spectrum disorder. So there's no need to avoid vaccines for autism spectrum. So I would say that, yes, it does appear that autism spectrum is far more common now than it was 20 or 30 years ago. But it has to do with what we call incidence and prevalence, right? Is it actually more prevalent than it was 30 years ago? So what we would say is no. What's different is our ability to understand it as a spectrum and our ability to understand it in terms of its nuances. So 30 years ago, 40 years ago, we all knew those kids in high school that were odd or really like had poor eye contact, might have been bright, like in a particular academic area, but, walked funny, walked kind of hunched over, walked, without moving their arms. We all see those kind of odd behaviors. We all knew those kids 30 years ago, but they were high enough functioning that they would not have been considered on the autism spectrum at that time. Now we understand in the higher end, so less deficits maybe in behavior, less deficits in socialization and communication, but still marked deficits. So because we're much more nuanced in our diagnosis, saying that about 1 in 36 children may have signs of autism spectrum is far more common than what we would have thought from 30 years ago, when we only really diagnosed autism when it was more severe. Those was very severe developmental delays, severe language delays, and severe deficits in their communication.
Okay, so just to clarify, 1 in 36 children in the United States is being diagnosed now with autism spectrum disorder. It's the fastest growing developmental disability in the world, but not necessarily meaning that there's some new factor that's causing it. You think it's more that the actual mental health community and the doctors, we're becoming more aware of how to diagnose it and diagnose it along a spectrum.
Yes, so it's not necessarily that, whatever genetic or environmental factor we can identify. It's not necessarily that it's happening more. We're just better at understanding and diagnosing it, and therefore we can understand it as a spectrum. There are individuals, individuals like Elon Musk and some other Bill Gates and other high-profile individuals who would identify themselves as being on the autism spectrum, but not what we would consider to be more severe in their deficits, right? That they have very, very focused interests. There can be some very, very bright individuals, but they have some deficits in socialization, deficits in reading social cues, deficits in understanding and expressing emotions. So that's when we say it's a spectrum disorder. There are such a wide range of deficits in how they present themselves.
And we hear a lot about sensory disorder with sensory processing disorder. I know that some people could actually have sensory processing disorder and not have autism, but we talk a lot about to help people understand why perhaps when you go to the Connecticut Science Center, they'll have a day for folks who are on the spectrum, or different activities at the movie theater. What is it about the senses that we need to understand?
So there's very often individuals on the autism spectrum have sensory issues. That's sensitivities around sensory experiences. So if you think about it, sensory experiences are your 5 senses. So it could be sounds, it could be sights, that are overwhelming. It could be touch. A lot of times individuals on the autism spectrum can only wear certain fabrics, or they can't have any tags touching them, or they can't wear long pants. They always have to wear shorts because they can't have anything touching their legs. So they have hyper focused sensory experiences, and that sometimes an overload of sensory experience causes them to become overwhelmed. It could cause them to act out. It could cause them to retreat. So, sensory issues are also a significant part of autism spectrum disorders.
And what do you think is most important that we understand now as we're raising awareness for Autism Awareness Month here in April? What do you think it's most important that the general public understand as we move forward, so that we can not only be inclusive, but really help our kids to understand maybe some of the kids they're going to school with?
Early intervention is the best intervention. The earlier we intervene, the earlier we provide accommodations in school, because often what happens with some of these young people is they start to build up a lot of negative social experiences, and those negative social experiences can be very traumatizing. So the earlier you intervene, so with more severe deficits, there are levels of intervention that can help lessen some of those deficits and make that child more functional in their ability to get through their day. But there are lots of accommodations that can happen in schools. Again, with more severe deficits, you definitely want them to be identified, because there are services as they become teens and young adults that they can get access to through the state. But public schools are equipped to provide interventions and accommodations for young people on the autism spectrum.
And if you're a parent listening and your child is on the spectrum, I mean, I know by now you've probably gotten a diagnosis, but let's talk about some of the accommodations and treatments from your side of the couch when you're in the office. What are some of the things that are helping, and some of the things that parents really should be asking for?
So a lot of times these individuals, they might need breaks from classroom experiences that become overwhelming to them. Again, it's that sensory overload. They might need work kind of broken down for them in a different way. What we always want to try to educate children in the least restrictive environment. So we want them in classrooms and with other kids as much as possible when they can. But there are times where their behavioral difficulties, their social emotional difficulties are such that they need more specialized settings, and that's okay too. More therapeutic day schools or specialized classrooms. So I think that's really important. And the other thing I want to point out, Kara, is that while as trained professionals, right, I can see someone very early on and notice some of the signs and symptoms of autism spectrum. But there are a lot of school-age kids who are not yet diagnosed, who do have deficits. And so it is bringing, if you're concerned as a parent that your child is really struggling in areas that don't make sense to you, or you see, you compare your two children and you think, well, my older child seems to be doing fine, so I must be doing okay as a parent, but my younger child is really struggling with communication. He doesn't ever look me in the eye. He doesn't seem to be able to express himself when he's upset or frustrated. I mean, there are kids with some, milder or moderate deficits that might not be labeled. We always start with your pediatrician, but, now we do have the Mary Parker Autism Center here at the Institute of Living. And you can see a specialist to get diagnosed, to see if you're on the autism spectrum, or to see if you perhaps have another learning disability, right? There are other learning disabilities, like a nonverbal learning disability. There are, sensory disorders. So it's a good way to get other disorders possibly ruled out.
Yeah, so talk a little bit about this center. Can anyone go, and how do you get the help that you need if you're feeling like, yeah, I have a lot of questions?
So it was developed in 2022. So it's comprehensive, evidence-based, multidisciplinary care for individuals on the autism spectrum to get a diagnosis if they need it. It can work with individuals and families. And, I can provide you with the phone number as a way to start to get connected and get help with resources.
Yeah, if you have it handy, we can shout it out just so that people who are listening or watching can jot it down. And if it's on social media, I'll try to put it in the comments. But if you wouldn't mind, state the name again in case people want to Google
Yep.
later, and the number. Yeah.
So it's the Mary W. Parker Autism Center here at the Institute of Living. The phone number is 860-545-7493. So that's 860-545-7493. And they can do evaluations, they can help with resources, and they can help you set up accommodations in your school system.
And what about when you're an adult? I mean, there are adults who are now going back and becoming diagnosed with autism. Is it helpful to get a diagnosis later in life?
I think it's always helpful to get a diagnosis because a diagnosis is really information. And the more information that we have about what our strengths or what our weaknesses and deficits are, the better we are able to help ourselves, right? There's a lot of younger people, young adults, and adults who are neurodivergent, meaning they're different in some way. And sometimes just having a label or having a name to what's going on helps them feel less isolated and less alone. I think it can be really helpful to put a label or put a name to something, because it provides that information and resources and support for you.
Yeah, I was reading a story recently that from the point of view of a child who's now an adult, that her father became diagnosed late in life with autism, and it changed everything for her because she thought her dad was just very disconnected from her, and he would, she would say, "I love you," and he would instead send a copy of some of their notes that they had been working on together, or he would really get into these, like all day on a Sunday, he'd be like focused on something. And she said, looking back, like now that he has this diagnosis, it helped her understand that he really did love her. It was the way he was expressing it, or the things he did were not because he didn't want to be with her. It was, so she said it's completely, the story said she just completely changed her whole relationship and her thoughts about what her father thought of her once she understood that he was on the spectrum.
Right, and those are examples of how people who are on the autism spectrum have deficits in their ability to communicate their feelings or understand the feelings of others, right? That reciprocity of feelings, that empathy. It's not that they don't care, it's that they don't understand how other people are feeling and might not have a way to express it. So, it's deficits in socialization. It's being fine being alone most all the time and not really needing any social connection. There are some individuals on the autism spectrum who do want to make some connections, but just don't know how to engage in that reciprocity of, I ask you how you're doing, then I wait, and then, you respond, and then, right. So there's a lot of actually skills in socialization that young people on the autism spectrum really struggle with learning.
And is it something that if you are on the spectrum, what are some of the treatments, both medication-wise, and can you teach empathy? Can you teach these social skills? Does that help?
Yeah, and early intervention is the best intervention. And so the earlier you intervene, there are lots of programs out there that are designed to really help support younger people. I don't know there's many programs for adults, but there are definitely programs for younger people to help them learn and build up their skills in areas where they have deficits based on their autism spectrum disorder.
There's still, especially in that younger age, right? Elementary, middle school, unfortunately kids can be mean, right? And sometimes these kids are maybe overreactive, or they're acting differently, or as a parent, if you're listening to this, how do you help your kids to more than just not be mean, but really understand maybe how autism affects some of their classmates so that they can be better?
I do think it's about having some tolerance for differences. I mean, it's hard in certain developmental stages. That's hard, right? I always say in middle school, you have to be the squarest of square or roundest of round pegs in order to fit in. And so many children are not like that. And so middle school is just a difficult time. And the more you can just develop a level of acceptance that not all children are exactly like you, right? That's that egocentrism that we often see at different developmental stages, but not all children are just like you. So there are other children who have different life experiences, that experience the world differently. They have, they have sensory issues. They just see the world differently. So the more we can kind of be open and talk about how it's okay to be different, I think that is always helpful.
Are there medications? I know that sometimes I hear about children using Adderall who are on the spectrum, and I know that that's traditionally thought of as a drug for ADHD, but are there certain medications that are common for other things but are also being used for some success?
Well, I'm not a psychiatrist and I don't prescribe medications. Medications are generally used to treat particular symptoms.
Okay.
So if a particular individual is having, severe difficulties in concentrating and attention, then, a stimulant medication could be helpful. I mean, there are a lot of, overwhelming experiences that could create depression in an individual. And therefore, if they're meeting the criteria for depression, then an antidepressant medication could be helpful. So medications would be used to treat particular symptoms that might be overlapping with the autism spectrum.
Is the way that we treat autism evolving and different now than it used to be?
Absolutely, because we understand it so much more now as a nuanced disorder. 30 years ago or more, young people on the autism spectrum were sort of shuttled away. But now, as I said, we want always to educate kids in the least restrictive environment. There are some children who have deficits where they need a more specialized setting, and that's okay too. But often we want to try to provide accommodations in the classroom, individualized education plans or 504 plans, for kids to have some accommodations so that we can support them, work with their deficits, but at the same time, really give them some unique experiences where so much learning and growth can take place.
Mm. And as you mentioned, I mean, I know we talk so much about the deficits, but it's important that we understand that folks who have autism spectrum disorder or ADHD or a lot of these things, there's also some special abilities, many of them, as you mentioned. Elon Musk has said, did you expect that I was a normal kid when I created all this? I mean, and most people would say Elon Musk is doing pretty well. So there's some things that we need to understand, that it's not all about the deficits, right? It's just sometimes that square peg, round hole.
Right. And so it's really understanding what someone's unique skills and talents are, right? So there are those individuals that we used to kind of call Asperger's, that more on the upper end, that might be brilliant in certain areas, right? I mean, the movie Rain Man comes to mind. Being able to do numbers, or being able to in that instance count cards. But there are individuals who have brilliance in certain areas, but really lack any kind of knowledge in their ability to socialize and their ability to communicate. So it's developing an appreciation for what someone's strengths are, and supporting or accommodating their deficits or their weaknesses when possible.
So the birth to 3 is really important. Is that part of, I mean, and I don't want to discourage people, because like you said, a diagnosis at any point can be helpful. And I notice a lot of people on social media. I know you talk about social media. There's some good ways of social media. So you can look at, there's some people out there that are explaining things that people are finding that they're finally seeing, or they understand these things. But let's go back to birth to 3. Is the reason the early intervention is important also because the brain is changing so much in those years?
Yeah, the brain's so malleable early on. And if you think about it, if you have a child that has more of the deficits, right? Deficits around communication, or deficits around any sort of socialization or social exchange, as a parent, that's really hard, right? That's really upsetting to see that your child is, 2, 3, 4 years old and not yet talking, or not able, engaged in a lot of the stereotyped behaviors, or a lot of the repetitive behaviors. That's very distressing as a parent. So, early intervention can help lessen the effects of some of that, but also can help you as a parent understand your child better and so you don't personalize, like, what am I doing wrong? It's not that you're doing something wrong. It's that this is the way your child is. Your child's neuroatypical, and meaning different neurologically. And we just need to find ways to get the best out of your child or maximize their strengths.
Yeah, and we hear that, right, about neurodivergent all the time, although I think all the qualifications that make people neurodivergent, we're all sort of different. I don't know exactly what normal is.
Right.
Yeah, so we
are all different.
A little different, but these are understanding the actual. So bottom line, for the takeaways here, you want to start with your pediatrician. Now, if you're older and you're wondering about yourself, where would you go to get a diagnosis once you're already older, perhaps an adult?
So there are practices that specialize in autism spectrum and neurodivergent young adults and adults. So you would want to find a practice. You can always start with your primary care. Usually they have access to some resources, but it's really just getting support. As I said earlier, I do think a diagnosis is important because knowledge is power. And the more information you have, the better you understand yourself, the more you can not get so down on yourself and maximize your strengths.
Right. And again, you have the new center at the Institute of Living, which has always been a premier institute in Hartford, Connecticut, though it attracts people from all over, and that's the Mary W. Parker Autism Center for evidence-based multidisciplinary care. People can go there, start with your pediatrician, but in general, it would be more of a mental health provider who would make the final diagnosis, like a psychologist or a psychiatrist?
Psychologist or psychiatrist, right. So often in order to have an official diagnosis, you have to have testing done. So you would want to go somewhere, we can't just slap a label on someone when it comes to autism spectrum. So you want to have some assessment or testing done so that you can get an official diagnosis.
We only have a final minute left, but I know that it's a little bit outside your expertise, but in your, I'll say, anecdotal and when you've worked with families, there's so much that talks about diet and certain lifestyle things. Are there things like that we need to consider that can really help?
I do think that there are always things that we can do, because a lot of times these young people might have additional complications. They might have additional either nutritional issues or sensory, in terms of your diet, sensory issues. A lot of times these kids have very restrictive eating and what they will or won't eat, and that is also sensory. So I think always having comprehensive care, but I don't want to mislead people that changing someone's diet will cause them no longer to be autistic. That is a myth, and I don't want to go down that road.
Okay. It can help, obviously, if you're very sensitive to certain foods. Removing them can, we've done stories on folks who've had some improvement. But again, I guess the important thing as we close this out is that it's important to be aware and that no two people with autism are alike. It is a spectrum, right, and there's many, many facets of it that we need to understand, especially if 1 out of 36 children is now being diagnosed.
Yeah, and those numbers come out of the CDC, and which seems like a lot. Right. Yeah. So it's much more commonplace than it was, 20, 30 years ago. But that's just in terms of our ability to diagnose and understand it as a spectrum.
Dr. Laura Saunders at the Institute of Living, as always, we thank you for sharing your practical advice and your wisdom. And thank you for helping us understand a little bit more about autism in this Awareness Month of April. Thank you, Kara. And if you want more information on the cutting edge of wellness, you can go back and listen to other podcasts right on the CURES podcast. Wherever you get your podcasts, you can download them. You can follow me on social media at Kara Sundlin. I do like to share this content there. Have a great day and be well.